COVID-19 pandemic and the community spread in St. Lucia. Prime Minister Honorable Alan Chastney is now speaking. We go to the podium.
The urgency behind these new cases is that they are very different than the cases we've had for the most part up to now. The cases that we've had in the past are cases of individuals that we know that had travel history or been in contact with somebody with a travel history. And luckily for us, the protocols that we put in place caused those persons who had traveled, who we consider to be high risk, to be contained in an area, in a quarantine, and therefore that when they turned out that they had positive COVID results, that we knew that it was contained. The difference here is that we've now had 4 cases in the last 72 hours in which none of the persons had any travel history. And as we speak now, we don't know where their source of infection was. I know that the CMO will speak to that and that we've have intense contact tracing taking place. We've had a significant increase in the amounts of testing that we're currently doing in order to try to zone in as to where we think this current community cases came from. In light of that and the risk that this imposes upon us as a country, it requires us to adjust. And as we've said, as the threat increases or decreases, that we will adjust. If in fact we're seeing that we are under less threat, we will loosen the protocols, but if in fact we see that we have an increased threat, we'll increase the severity of our protocols. So we have, and we are in a position now where we do know that we have some kind of community spread, the extent of which we don't know, and I'll let the Madam CMO address that shortly. But it is going to require some changes in our protocols. Sadly, a student of Castries Comprehensive School has tested positive. The good news is that he was asymptomatic at the time, and therefore we think that their threat of spread is minimal, but we have to take all precautions. And therefore it will require some amendments to our educational protocol over the next 2 weeks, and I'll allow the CMO and the Minister of Education, who's also here, to address the specifics of that. At this point, I would like to introduce the chairman of our command center, Dominic Fede, who's also the Minister of Tourism, who will be in charge of moderating today's meeting. But it was certainly for me to assure you that there is no need for panic. What there is need for is action. And that action of each individual St. Lucian to take this situation serious, to understand that we can fight this situation and improve our current situation in St. Lucia and protect lives and protect our economy. And I'm now going to hand over to the chairman of the command center to moderate this meeting.
Well, thank you very much, Prime Minister. Let me again recognize the presence of everyone here, but please, with your permission, I would like to acknowledge the members of the head table, which include Honorable Gail Rigobert, Minister for Education, Honorable Mary Isaac, who's the Minister for Health. We've got Dr. Sharon Belmar George, the Chief Medical Officer. We've got Mr. Honorable Joachim Henry, Leader of Government Business in the Senate, and he's representing the Leader of the Opposition here today. We also have Ms. Doreen Gustav, who's the head of NEMO. Would like to also recognize other ministers in our presence. Honorable Fortuna Belrose, who's here, as a member of cabinet. Honorable Sarah Flood Bobra, who's the Minister for Foreign Affairs. Members of the command center, the PS in tourism, Ms. Donalyn Vite, Deputy Police Commissioner in Mr. Milton Daisy. We also have the presence of the Police Commissioner, Mr. Sovereign Mashari, and other leading members of the police force, officials from the Office of the Prime Minister, and other leading members of civil society and leading public sector bodies in St. Lucia. We also have a number of ministers joining us by Zoom, and we also want to recognize all the radio stations that are joining us here today live in this multicast. We're reaching many homes and living rooms, and we are here today because our government is proactive and serious about responding to COVID-19. And what we're seeing here today is not a panic, but really a decisive and insightful approach to ensuring that we're on top of the COVID-19 response. So, having introduced the head table, what I want to do is to now go straight into the CMO's presentation, our main presentation for this afternoon, so that we can leave some time for questioning and comments around the floor. So CMO, I'm going to pass the microphone on to you, or are you using the cordless mic?
Thank you very much. I will accept the protocol that's already been established. Good afternoon to everybody.
Just give us a moment to fix the slides. We want to make sure that our viewers on television can also join the presentation as well.
Okay.
Yes, CMO.
Okay, I will give a brief synopsis of the present situation of St. Lucia during the COVID-19, our present situation, and some of the decisions and discussions and recommendations moving forward based on where we're at. This is our dashboard here, giving you a summary of where we are. As most of you have heard, we're now at 32 confirmed cases of COVID-19. 29 of those cases have been nationals, 2 British and 1 American. 19 of them have been imported cases, and 13 of them locally. Our last 4 cases have presented a different scenario for us within the ministry and for us as a country, as compared to the others that we have managed previously. Our case number 29 did not have a travel history, and also there was significant movement within communities during the symptomatic phase. This case, as compared to the other cases, we have not been able to effectively and efficiently do the investigations and contact tracing to be able to get to, to be able to get to our index case to allow us to cover all of our bases. Our last 3 cases, which was the couple and the student from the Cashews Comprehensive School, also gave the possibility for transmission to a wider group. Our teams have been on the ground, both within the communities and also working closely with the Ministry of Education to see how we could try to contain this case as efficient as is possible. But given that for case number 29, we were not able to get the index case, we anticipate and expect that we will be getting other cases within the community. So we've increased our surveillance and a number of measures to be able to manage. We've also done a total of 9,027 tests, And these numbers are increasing on a daily basis as we continue our assessments. To be able to effectively manage, we have a number of indicators that we use to look at where our status is on a health basis. So we look at the number of confirmed cases per 10,000. We monitor the rate of hospitalizations, ICU hospitalizations. We also look at the number of deaths that we've had. We've had 0. Also the recovery rate, because we have 4 active cases still in care. We had 84%. Also our testing rate and the number of tests that we've conducted. As I indicated, our last 4 cases have had no travel history. Our origin, we're still investigating, and this poses a risk of community spread to us. Earlier on in our prior meetings, we used a phased approach for the reopening of the country. This is just a reminder to where we are to the public. The opening of the border, we were at phase 5, and the steps that were required, the vigilant screening at the ports of entry, which we've set up at our ports of entry, sustainable testing capacity, and the strengthening of our protocols and safety measures, cures and vaccines. And our triggers to revert to phase 4 was large increases in community spread, that is about 50 cases. Over the last few months, we have been speaking about the fact that COVID-19, as estimated by the regional and international public health agencies, would be here for about 2 years. So unlike how we responded earlier on in the outbreak, countries are asked to take a different response and learn to live with COVID. That is, you use protocols to keep your country safe, but you manage, and for us, we anticipate and expect to be managing small waves of disease without having to go through any extreme measures. So based on the 4 cases that we've noted within the last less than 14 days, some of the decisions that we're looking at in terms of implementing would be an enhanced communications campaign and public relations. That is mass communication, using safety tips for the home, the school, and at work. Increased training and retraining for the awareness and use of PPEs. To develop communication strategies for the return to work and normalcy for individuals who have contracted COVID-19. Also, a contact tracing app which will be launched within very short time. Also, the enforcement of social distancing and PPE protocols in public places. For us to be able to live safely with PPE, we have to live like everybody else has COVID-19. And with these protocols, even though we have persons who are positive, if we use them effectively, it would significantly reduce the possibility of transmission to other persons and transmission into the communities. So that is increased enforcement we would need by the Royal St. Lucia Police Force, the support of our community leaders, and a bipartisan approach to health and safety within the communities, the mandatory enforcement of the face mask use in public areas. In terms of the impact that we note at the level of our secondary school, the educational sector to remain in the present phase that they are with the limited face-to-face contact. We've been managing with the Ministry of Education, looking at how we move to the second phase with increased face-to-face, but given that possibility of community spread, we remain with the present protocol of face-to-face. Also, for the school that's impacted to remain closed for the next 2 weeks while we do assessment and testing presently, and for all other schools to remain closed for a period of 1 week. The other service, the other activity, which is high risk for the transmission of COVID-19 is mass crowd events. We are presently at 500 persons. The decision to reduce mass crowd activities to limit it to 100 as we monitor and manage the situation on the ground. All sectors with the phased reopening of the economy presented plans, COVID-19 safety plans to allow the safe reopening of their organizations. We noted over the last few weeks a level of complacency and non-adherence to those. There'll be strict enforcement of protocols, from community markets to nightclubs to dances to beach parties to weddings, funerals, church activities, and boat rides will be limited to family excursions only, taking out the public boat rides which pose a risk to us. So all of those activities will be strictly enforced per protocols or run the risk of losing their licensing or being closed within very short measures. Also, we're coming close to the Journée Créole activities. Those will be limited to family home activities, and the community activities will not be allowed. I think that's it for the recommendations.
Thank you very much, CMO, for that comprehensive presentation. We'll now take some comments from the Honorable Minister of Health.
Thank you. Good afternoon, everybody. I just want to use this opportunity to emphasize the fact that there are serious implications when we do not follow the protocols. Something that is as simple as wearing the mask, washing your hands, social distancing, and we have so many people disregarding the protocols to the point where now we probably have community spread. I, for one, maybe I am still in shock. I know that we expect that to happen. We expect to have some form of COVID impacting St. Lucia at any one point in time. But I know that for now, we have been able to contain it. And my hope was that we would continue to be able to contain COVID, even when it is actually introduced through maybe people traveling or something like that. But now we are seeing that we have cases, and we cannot, so far we have not been able to trace exactly where these cases emanated from. And that is very worrying for the Ministry of Health, because I know the workers, they have worked so hard. They have, worked tirelessly to ensure that we contain the virus. The Ministry of Health, the Ministry of Tourism, our frontline workers, the police. At one point, we had the country broken up into 2 zones, and we heard all the talk about it. We instituted the curfew, and there was even more resistance. But at least at the end of the day, we saw the result. We saw the result of our hard work. But now we are seeing that this is being broken down. And the worst part of it is that we are not able to trace where the contagion came from. So I am saying that these things, these reckless actions by people amongst us, by our citizens, some of our citizens, have serious implications. Because right now we have almost exhausted all the funding that we could put in health, in additional health care. We have had to retrofit the Victoria Hospital to transform it into a respiratory hospital, something that was not in the books at all. So we have had to find additional monies to do that. We were forced to open OKEU before we were actually prepared to go into that hospital. And all of this effort now, we have to roll back during another epidemic, a dengue epidemic. And there are other health issues that we have on the table that are being ignored or neglected. Well, Ministry of Health is not ignoring it, but they are being neglected because we have to take everything that we have and put into COVID. This is a pandemic, and for some reason, many people seem to go about life as though it is business as usual. I do not know if it is because government has done such a good job. The ministries, the public workers, the frontline workers have done such a good job in containing the virus that many people do not recognize the danger that is out there. So I know that NEMAC, you have key persons here with us today, persons of influence, persons who can educate people out there and make a difference. So I am appealing to all of you from the Ministry of Health for us to do everything that we can in our power to educate our public, educate our people, and cause them to realize and understand the impact that COVID can have in this country. We do not have the resources or the finances to manage and control a large amount of community spread. And this is why right now we have called for the closure of schools, which is again going to impact negatively on children whom we already had out of school for such a long period of time. We have had to close schools again. Some departments of government had to close because people are panicking. And every time people panic, it's because they are genuinely afraid. People who took that bus, they are trying to figure out, was I on that bus? Did I come into contact with that individual? So there is a lot of panic that is spread out when we get an additional case, an additional case. And it is causing the little resources that government still have, it is causing additional strain on these resources. Already we are not able to roll out additional stimulus packages and so on and so forth. So, and we know that Christmas is coming. We've already curtailed on Journée Creole. This is one of the discussions that we are going to have here. We know Christmas is coming, and many, thousands of our people are out of work. So we need to do everything that we possibly can for us to contain this virus, for us to keep people who may be suffering from COVID-19 at bay, for us to protect our borders. We have now become our brothers' keepers. We must become our brothers' keepers, because when you're in a community and you see a person who's supposed to be in Martinique or supposed to be somewhere else and the person just show up, you need to be able to report that to the authorities. You have to, we all have to do what is necessary for us to contain this virus. It may well be our own lives that we are saving. Since the since the information went out about the last 4 cases, actually case number 29 is the most problematic. Because now, as you may have heard, he's not cooperating. He's not giving out information in terms of where he may have contracted COVID-19, because he has no travel history, like CMO has said. And it is one of the most problematic cases that we have had. So I may sound very emotional about this, but I know that if all of us come together and do what is necessary, united, we can fight this virus and we can keep it at bay. But we all have to play our part. We all have to play our role to protect the rest of this country, to protect our children, and to protect everybody else that needs protection from us government authorities and everybody else. So this is what I have to say to you today, to join us. Do not allow this to just be a Ministry of Health effort or a government effort. It has to be all of us united in fighting COVID-19. Thank you very much.
Thank you, Madam Minister, for such profound words. Very profound point, suggesting that 4 cases have actually had such severe implications on the entire country's education system. And so to tell us more about that and to explain with greater specificity would be the Minister of Education, the Honorable Dr. Gail Rigobert.
Thank you very much, colleagues at the head table, those here with us and those online, media, fellow citizens, good afternoon. You would have heard that we have had reason to ask that the Castries Comprehensive Secondary School remain closed for 2 weeks, and the CMO has articulated the justification for that. We have asked similarly that all other schools remain closed for 1 week in the first instance while we monitor developments. Very importantly, during that period, we will return to the multifaceted mode of learning and teaching, employing both traditional methods and online learning. The Ministry of Health during that time will continue with its contact tracing and other exercises. We will continue to work very closely with stakeholders, partners, sister ministries, and agencies as we monitor developments. And we want to reassure you, the public, parents and guardians in particular, that we are committed to safeguarding the health and safety of our nation's children and the teachers, ancillary staff who are engaged in the sector. In fact, earlier today, a multi-sectoral, multifaceted, multi-talented team met to review the existing protocols that govern what we do in the education sector. And we want to thank our partners for their full participation in that exercise, all aimed towards ensuring that not only are our protocols apt or adequate, but more importantly, that when dealing with a situation such as the one that we are dealing with right now, that we minimize the disruption to instruction, we minimize the disruption to learning opportunities for our students. It is for that reason I'm compelled to ask the public to cooperate with us, to adhere to the protocols, because maybe it is something that we take for granted in part, but schools are the places that we harbor the most human beings in any given space on this island. In some schools, we have over 700 students. These 700 students live in households. And that is why we have been so adamant that within the school environment in particular, that we are to adhere to the protocols, that we are to prove to be compliant for our sake, for the sake of our children, for the sake of the nation. So I want to thank all of you who have cooperated with us thus far, but to implore you to do even more, because as my colleagues have indicated, we have relaxed a little bit, and these recent cases therefore serve as a wake-up call to all of us, that no one is exempt, no one is immune, that we never know where, when, or how the next case may rear its head. So let me therefore say to parents and guardians who I'm sure are very concerned at this time, that we in the ministry share your concern. Your children are our children. They are the nation's children. We care too about our teachers, ancillary staff. We are one family. So I beg of you, please, do adhere to the protocols, because it means that you are saving your life as much as you are saving my life and that of the nation's children. Thank you.
Thank you, Madam Minister. I would like to kindly solicit a few words from the member representing the opposition, leader of the opposition here today. And I had erroneously stated previously that he is the leader of government business. He's the former leader of government business in the Senate. But however, he's a dear friend of mine. And I would like to solicit a few words from Mr. Joachim Henry.
Thank you very much, members of the head table. Good afternoon, ladies and gentlemen, and other St. Lucians who are listening. Good afternoon as well. I'm the standing member of NEMAC for the leader of the opposition. And of course, the political leaders asked me to convey his wishes, well wishes to all St. Lucians at this time. We're listening to what is being discussed here. The opposition supports the measures taken by government at this time so that we can, control, we can contain COVID-19. The leader of the opposition did indicate that we are concerned about families, children, and all those who may be affected by this COVID-19 situation. We are concerned about the spread of COVID-19 in St. Lucia. The leader of the opposition, as well as all opposition members, also concerned that we are forever in safekeeping all members who are here, and that we protect our children at the schools. But we would like at all times to receive information that is current, information that is timely, so that we can continue to advocate on behalf of our people. Notwithstanding the time that we are in currently, we wish to inform St. Lucians that there's no need to panic. We can take care of the problems as we have done in the past. The opposition will stand with the government to ask all St. Lucians to adhere to the protocols, to the guidance, to the instructions given, so that our children, our families are safe at all times. We wish to thank the government at this point in time who've invited us here to make our contribution as we tell St. Lucians that we are together, all in one, as we put St. Lucians first at all times. Thank you very much.
Thank you, Mr. Joachim Henry, and I'm sure that the government appreciates very much the bipartisan approach with which your party has approached this response. So we look forward to working together in such a difficult time. We all have to come together to win the information war, especially at times like these. We continue to see false information being peddled across the spectrum. And I think that it makes our response to this pandemic increasingly difficult unless we work together as civil society, political directorates, the media, clergy, and we need basically a national fight to be able to win this. And so with that in mind, we open up the discussion and we take some comments from the floor, some questions that you may have in terms of what is taking place here today. So we are here to answer any questions and comments that you may have.
CMO, the first question is that will churches be allowed to operate this weekend?
Yes, churches will be allowed to operate. The recommendation is to reduce the numbers for mass crowd activities from 500 to 100. But that being said, for an activity of 100, must keep to the space allocation as per the protocols that have already been generated. So what we are asking is that all activities keep to strict adherence of the protocols in terms of physical distancing, use of face masks, and the infection prevention control, including the use of the hand sanitizers.
With your permission, Chairman. No problem. Just before you speak, I just want to really just indicate that we're coming out with recommendations as to how do we deal with the situation with the information as we know it today. As I said, many of the remedies that we're recommending would be required anyway. So clearly, I think that we all have to be honest with each other. There has been a drop in the standard of adherence to the basic protocols. So the first thing that needs to happen is what was already on the books and established, we need to go back and seriously take it up. So there's no excuses when we go to a nightclub or pass by a bar and people don't have masks on. There's no excuses when we see buses and the driver and the persons in the bus don't have their mask on. So the first thing that we must do is put an end to that. We must all be each other's brother's keeper. It's okay if somebody is going to forget or not think it's important, but it's worse when the 9 people around them don't say anything or do anything. That's what we're calling upon in this nation. That this is a wake-up call that COVID is real. This idea that people want to think in their mind that we were free from COVID and there was some special serum that we had that was preventing COVID from coming here, it was the protocols that we had in place. That was what was keeping it away from here. And most importantly, it was our countrymen's implementation of those protocols. That's why at no point did we as a government accept the full responsibility or the full credit for what was taking place. Every intervention, it is all of us together. Let us accept that we have let our guard down, and it's time initially, right now, that we raise our guard. Depending on what the results are going to be over the next week or so, we will determine to what extent COVID is in our communities. That may require further interventions. As we speak today, what we're asking for is, one, we want to get your initial feedback on it, is to close down the schools, all schools for 1 week. And that comprehensive school will be closed down for 2 weeks. That we're now going to go from 500-person mass crowd to 100. That beach parties are not allowed. So there will be no music allowed at the beaches. Please go and enjoy a good sea bath at the beach, but the idea of having a festivity at the beach is not on. And because Jeune Creole is coming up, that we're going to now not allow mass crowd events for Jeune Creole. So the idea of closing down the street and having barbecues and loud music, that's not going to be prohibited, allowed during this period. We're saying at the Castries Market tomorrow, wear your face mask, bring your hand sanitizer. We will have policemen out in force. We will have hand sanitization liquids readily available for everyone and making sure that we're adhering to those principles. Let us go back to greeting each other with an elbow, with a prayer, touch your feet, but no hugging and no shaking of hands. If in fact that you feel any symptoms, do not come to work. If you don't know what to do, call 311 and get information on what to do. So the meeting today is for us to share where we're at with you right now and to get feedback from each one of you as much as possible on your initial thoughts and what you can possibly do to help the situation. And more importantly, that can contribute to the recommendations being made by the Ministry of Health for our cabinet meeting on Monday, that we could now approve those recommendations and immediately get the SIs out to provide the enforcement or the authority for us to implement those things. Thank you.
Thank you, Prime Minister. I think we have our first question on the floor. Just before you go, sir, there are about approximately 80 individuals by Zoom. If you want to ask a question on Zoom, indicate by raising your hand, and our moderators on the virtual platform will be able to allow you in so that the question can be asked. So, sir, if we can have your question, thank you very much. We'll take it at this time.
Thank you, and pleasant good afternoon to each and everyone. Yes, the Prime Minister highlighted part of my question. He mentioned the word intervention. My question is that, thinking of it from a worst case scenario standpoint, as presently we do not know the number of individuals out there who may have the COVID and we are not aware of it. So I'm not being pessimistic or calling upon our country doom and gloom or anything of that sort. But you have to think in terms of worst case scenario, if per adventure we may have to shut down. What are our plans in terms of keeping us afloat from a standpoint of feeding ourselves? How closely are we working with the Ministry of Agriculture to have maybe short-term crops? I'm just saying, if per adventure, we may have to go to another shutdown, as we do not know how long it may last or the severity of what is out there, of the unknown. That's what I want to ask. What are our plans in terms of keeping us healthy?
That's a very good question. So the quick answer to that question is we have no intentions of shutting down. So shutting down is not an option. Can the situation get worse? Yes. But you know, this is not March. This is not April. This is not May. This is not June. This is not July. This is not August. This is not September. This is October. And we understand COVID. If in fact you wear your face mask, you practice social distancing, we can cure this problem. We can solve this problem. Taiwan has shown in a hotspot area, they've never shut down their domestic business. We're trying one thing more difficult than they're trying, is that we've been open for business since June. And we know that once persons come through the corridor of pre-testing, being registered, and that we're monitoring you, we've only had one case of a person coming in who's tested positive once they got here. And that person was contained. Here's the problem. I mean, let's not run away from it. That we have persons who are coming in through the back door. And we still have St. Lucians who somehow, I don't know, it's beyond me, honestly, that somehow can justify that in their mind? That it's okay to allow them to do that? And those same persons who are in contact with them are going back to their own homes and exposing their own family, exposing their own friends, exposing their own neighbors. How is it that we would have to have that conversation? And this is why I'm saying to you, if individuals in this country cannot see the reasoning of what is going on and don't want to see what's taking place against the rest of the world, all of us who remain silent are as guilty as they are. So how does that mean? If you have a bus that comes up to you and the driver doesn't have his mask on, or persons don't have their mask on, as difficult as it is, don't get into the bus. And take down the bus driver's number and file a complaint. Because that is going to come back and haunt you. You can't run away from it. I mean, when I hear people calling up on phones questioning whether in fact the information that's being provided by the CMO is correct, and we say nothing, our same civil society leaders say nothing. That's what I'm calling upon here today. We need to change. We need to recognize that this thing does not discriminate. They couldn't even protect the President of the United States of America. The Prime Minister's wife in Canada, the Prime Minister, Boris Johnson, got it. Who are we? The only way we can protect ourselves is by being each other's brother's keeper. It's the only way. And we have to have zero tolerance. We were getting away with it because for the most part we didn't have it in our communities. We now know we have it in our communities. And that's why I'm saying to you, we don't need to wait until tomorrow or next week to find out what the numbers are. The remedy is the same. Persons who are currently infected, can't change that. We need to try to help them find out that they are infected, get them to quarantine as quickly as possible, but the rest of us need to be safe practices. And I assure you, there's a study that came out today that said if you're in a plane and everybody's wearing their face mask, even if there are individuals who have COVID on that plane, you minimize the likelihood of you becoming affected by wearing your mask. That's all. And that's until we have a cure. So please, let us not get to the point where we have to shut this country down. And clearly if we have, I think that the CMO has worked out the math. I think that we can ideally not have more than 2,000 people affected, because if you take 5% of that, that's the number of beds that we have at Victoria. But we don't want to get to that number, and we don't have to get to that number. All right? So the greatest crisis would be if we have significant numbers in which we cannot accommodate people in hospital. We absolutely don't want to get there. We've succeeded in staying away from that. Right now, this is just an alarm bell to say to everybody, remind everyone COVID is here. It's always here, every day, the threat of it. And how fast it spreads depends on our discipline. That's all it is. And so we're calling upon all of us, go back home, reinforce the rules. Reinforce the rules at church, reinforce the rules in your households, reinforce the rules in your businesses. All of us must become champions. All of us must be shaming anyone who does not adhere to the rules, because in essence what they're doing is they're threatening the economy of our country, but more importantly, they're threatening the lives of people in this country. I don't think that that is too difficult to ask for. But we're just coming out now in force to reinforce that. We've asked that we raise the number of public messages significantly. We're meeting with I think we've met with the radio stations and the TV stations already to ask them to join back on board and getting this information out. But this is all to our benefit. What's at risk here immediately is the success we've seen on the international tourism front. We're in a bubble with the UK. BA is going to 5 flights a week. TUI is starting flights to St. Lucia. American Airlines flights to St. Lucia are at 72% load factors. 80% of our hotel rooms will be open in November. That's where the resources are coming for to be able to re-stimulate this economy. It's getting people re-employed. Our farmers now are getting their markets back. And we can show the rest of the world that you can coexist with COVID. Discipline. Every day you go out, think of somebody who you love, keep that person in your mind, put your mask on. bounce. No hugging. And just do your part. If everybody does their part, that's all we need. Everybody do their part. We do not want to get to a point that we have to close down. I don't even want to begin to envision what that would be. Okay, that needs to be taken out of our minds. And if in fact that we have to become more draconian in imposing the protocols we have, we will do it. I am not going to be intimidated by anyone to suggest that we're taking away persons' individual rights in this country. Everybody has a right in this country. And the majority speaks. And those rules are there. We can either agree to do it voluntarily, or we will impose the letter of the law on those people who are refusing to adhere. Because this is for the safety, not only health-wise, but economically for this country. And I'm dead serious. I make no apologies for that. And this attitude that we're trying to oppress people, nobody's trying to oppress anybody or take anybody's rights away in this country. But we have a responsibility to protect the people of this country. We've done a great job so far of both protecting their lives as well as protecting their livelihoods. And we will maintain that measure. But please, we don't need to go there. There's enough motivation for every single St. Lucian to be motivated to do the right thing. That's what we want. Do the right thing. Thank you.
Thank you very much, Prime Minister. I think we've come to the close of the open session. And we're going to have the closed session now, but we want to thank our television viewers. We're not streaming live anymore. So we're only on Zoom, and we're taking questions from the floor, as we have been. But this is just to sort of indicate that we've come to an end of the session where we're going live on television. Thank you, and may I now have your question now?
Okay, my greatest problem is that the minibus.
Well, there you've just had the open session of that special meeting of the National Emergency Management Advisory Committee, NEMAC. Primus, we heard a lot coming from the head table, including the Prime Minister, Honorable Alan Chasney, who just spoke, and who minced no words in letting St. Lucians know that the government is definitely going to apply the letter of the law if needs be in order to have individuals cooperate and maintain the protocols. Primus?
Merci, Lucia. Merci, Madame. Comme Lucia dit, situation qui est très sérieuse, l'événement du corona, et NEMAC qui a une responsabilité pour adresser cette situation pour ça. Très jeune, et avant ça, mon cabinet du gouvernement était jeune ensemble pour discuter avec ça. Comme ça, une situation a venu très critique quand Dr. Sharon Velma George dit, et c'est ça qui fait, c'est mon salle assemblée ici, après le ministre là, ministre de santé, c'est ministre qui est responsable pour affaires touristiques, et M. Joachim Henry, on a Joachim Henry qui a représenté l'opposition, qui dit qu'il y a supporté le gouvernement à ces il faut ça là qui a fait pour adresser cette situation. Le Premier ministre a parlé très fort et qui m'a demandé ça c'est une situation qui est et pour commencer à observer ces règles là et si il faut faire tout ça qui est nécessaire pour obliger les gens à observer pour protéger santé nous pour protéger la vie de tout le monde et ça s'en va et que ça il y a le Premier ministre est très sérieux sur ça à ce démarche là que nous faisons pour protéger nous et pour nous booster ces diverses activités qui particulièrement à public côté monde qui assemblé ensemble à besoin ça descend pour 500 ça descend pour ça à l'église publique à sur plage le premier côté et ça c'est une situation côté problème ça pour la situation si j'ai j'ai longtemps et que c'est raison qui fait ça qu'a fait il est nécessaire pour presser accès à ça.
Okay, Indeed, Primus, thank you so much for that synopsis. Just to remind to go over, so far we've had more than 9,000 tests that have been done. The education sector is going to remain in phase 1 on with the blended learning approach. The Cassius Comprehensive Secondary School is going to close for the next 2 weeks. All of the schools are going to remain closed for 1 week, and there will be a reduction of the mass crowd from 500 to 100. The markets, nightclubs, dances, beach parties, wedding, funerals, and boat ride. All of these things are now being measured. We want to say thank you so much for tuning in to the special broadcast of the NEMAC meeting, and we're now going to close off as the closed session of that meeting continues. I'm Lucia Joseph alongside Pamela Hutchinson.
On land, so we shall be able to end or remedy that.